Hello, everyone. My name is Claudia,
My name is Marissa.
My name is Fernanda.
And my name is Samantha.
and the research topic we will be discussing is the prevention of type 2 diabetes in women with a history of gestational diabetes. Here's our table of contents. Throughout this presentation, we're going to be going over our introduction, our case study, our PICO statement, search methods, synthesis of evidence, nursing implications, conclusion, and references. Introduction. Gestational diabetes mellitus is one of the most common complications that occurs during pregnancy, with its incidence increasing not only in the United States, but also on a global scale. Although these complications of gestational diabetes pose concerns with a woman's pregnancy, women with a history of this condition have become one of the most at-risk populations to develop type 2 diabetes consequentially. Gestational diabetes is detected in about 8% of all pregnancies in the US, and its prevalence is continuing to rise. In 2021, it was reported that diabetes affected 537 million individuals worldwide. But among that number, 90% of those cases were attributed to type 2 diabetes. It has been noted that a major risk factor for the development of type 2 diabetes is a health history of gestational diabetes. Women who have been diagnosed with gestational diabetes during pregnancy have approximately a 7 to 10-fold risk of developing type 2 diabetes in the future. Now, looking at this data, we begin to ask ourselves, is there anything that could be done to lower the risk of developing type 2 diabetes a, after a diagnosis of gestational diabetes? And we consider this before we start looking into interventions such as medications or non-pharmacological interventions. And some of these interventions could be lifestyle changes. So, could simple lifestyle changes impact or aid in significantly decreasing the diagnosis of type 2 diabetes in women with a history of gestational diabetes? How could weight management and positive diet changes impact these individuals? Could implementation of physical activity also produce a positive change? So, we begin to ask ourselves, why does this matter to nurses? It is crucial for nurses to understand the disease process and how to manage gestational diabetes in patients. Some consequential complications of gestational diabetes that could arise in the mother include development of type 2 diabetes, postpartum depression, cardiovascular disease, and this includes hypertension and metabolic syndrome. Consequential complications that could also infect the infant are neonatal hypoglycemia, respiratory distress syndrome, and they could also be born prematurely. So, as nurses, one of our fundamental obligations is to promote health and prevent illness, and also restore our patients' health. Seeing this relationship between gestational diabetes and type 2 diabetes, it is important that we begin to ask ourselves, what nursing interventions could we implement to help our patients? These interventions will not only aid in decreasing the consequential development of type 2 diabetes, but also improve the overall life of our patients. Now, going into our case study. Pregnancy is a moment in a woman's life that is full of excitement and anticipation. In this new moment of anticipation, some expecting mothers could have faced challenges, and one of these challenges being gestational diabetes. Gestational diabetes can cause a great deal of concern and health for the mother and the baby. So, for our case study, we conducted an interview on a 31-year-old Hispanic female. The participant has a medical history of obesity and was diagnosed with gestational diabetes at 28 weeks through her second pregnancy. Although the participant was not given any medication, her primary care provider suggested changes in her lifestyle. The participant stated that she delivered a healthy baby at 36 weeks of gestation. However, she was diagnosed with type 2 diabetes 15 weeks later, after giving birth. The first recommended change was to speak with a registered dietitian to create a healthy meal plan. The participant was encouraged to regularly monitor her blood sugar levels as well as conduct moderate exercise. As time continued, the patient incorporated healthy carbohydrates, low fats, and lean sources of protein to all her meals. After diagnosis, the participant was prescribed metformin 500 milligrams daily for her diabetes. The participant noticed that something else was wrong, and she began suffering from severe exhaustion and a prominent rash that developed on her cheeks and her nose. The participant expressed that she was unaware of the symptoms and the health risks of gestational diabetes or the increasing risk of developing type 2 diabetes after gestational diabetes. So, with this said, the conclusion of this interview led us to question, how could lifestyle interventions compare to no interventions? possibly affect the progression of gestational diabetes into type 2 diabetes?
Key code statement. Key components. Our population was a 31-year-old female patient with gestational diabetes. Interventions. How does lifestyle impact the progression from gestational diabetes to type 2 diabetes? Comparative. Comparing a lifestyle with a healthy diet and regular exercise to a sedentary lifestyle. Outcome. The changes to a healthy lifestyle affects the progression from type 2 diabetes even after being diagnosed with gestational diabetes. Time. Within 1 year of women being postpartum. Our people question was, among females with history of gestational diabetes, how does implementation of lifestyle interventions, including weight, physical activity, and diet, compared to no interventions affect the progression of type 2 diabetes? Search methods. Research process. Step 1. We interviewed our case study patient to learn their specific health care concerns. Step 2. We developed a PICO statement to establish the basis of our evidence-based research. Step 3. Search databases using CINAHL and Medline. Step 4. Found research and studies from the past 5 years that related to our topic. Step 5. Consolidated information found and gathered data that was relevant to our research. Operators and limiters. Our population, as I mentioned, was a 30-year-old female patient with gestational diabetes who developed type 2 diabetes. Our interventions included: how does lifestyle impact the progression from gestational diabetes to type 2 diabetes? Comparison. Comparing a lifestyle with a healthy diet and regular exercising to a sedentary lifestyle. Outcome. The changes to a healthy lifestyle affects the progression from type 2 diabetes even after being diagnosed with gestational diabetes. Boolean phase. We used and or.
Now on to the synthesis of evidence. So our first article is a mixed method study titled Modifiable Risk Factors and Long-Term Risk Factors to Type 2 Diabetes Among Individuals with a History of Gestational Diabetes Mellitus, a prospective cohort study. As mentioned earlier, women with a history of gestational diabetes face up to tenfold higher risk of progressing to type 2 diabetes mellitus compared to the general population with no history of this condition. However, research has shown that making changes to lead a healthy lifestyle can reduce the risk of type 2 diabetes despite a person's genetic disposition. With this in mind, this study is conducted with the purpose to evaluate modifiable risk factors such as diet and physical activity among women diagnosed with gestational diabetes mellitus. This purpose of this study is also to assess how the implementation of these factors reduce the risk of developing type 2 diabetes over a span of 28 years. The sample size for this cohort study consisted of 4,275 women within the United States with a history of gestational diabetes. Data was collected through a cohort study which consisted of a 28-year follow-up and observation of the identified participants. Qualitative and quantitative data were collected through the use of questionnaires and physical follow-ups with participants. This study found that women with prior gestational diabetes who adapted 5 modifiable lifestyle changes had over a 90% reduced risk factor of developing type 2 diabetes, even among those with a genetic disposition. Our second article is a systemic review and meta-analysis study titled Systemic Review of Lifestyle Interventions for Gestational Diabetes Mellitus in Pregnancy and Postpartum Period. The purpose of this was to assess the responsiveness of lifestyle interventions such as physical activity, a diet, behavioral support, glucose regulations, weight control, and education about both gestational diabetes and type 2 diabetes during pregnancy and the postpartum period in women with gestational diabetes mellitus, with the goal of preventing or delaying the progression of type 2 diabetes mellitus. The sample size of this study consisted of 2,569 women across 7 studies that were conducted in what are considered to be developed countries. 7 databases were utilized for systemic review, including OVID, Medline, and CINAHL, using keywords such as diabetes prevention, gestational diabetes, lifestyle, postpartum period, pregnancy, and systemic review. Major findings revealed that lifestyle interventions, particularly goal setting, contributed the most to successful outcomes, specifically reducing the risk/incidence of type 2 diabetes mellitus. Moreover, finding implemented during the postpartum period showed a much higher probability for positive results. Meanwhile, successful interventions during pregnancy varied, with most success in the early first trimester. Our last article is a systemic review and meta-analysis study titled Systemic Review and Meta-analysis of Type 2 Diabetes Prevention Through Lifestyle Interventions in Women with a History of Gestational Diabetes. As mentioned earlier, diabetes has become one of the biggest health problems globally, with up to 537 million adults affected in 2021 alone. A noticeable pattern in the population with type 2 diabetes are women with a history of gestational diabetes. With this in mind, the purpose of this study was to review the effect of lifestyle interventions in women with a history of gestational diabetes mellitus based on participants and intervention characteristics. The sample size of this study consisted of 123 articles eligible for test screening, with a total of 2,626,905 participants extracted from these studies. 7 databases were used for the systemic review, including Medline, CINAHL, and Embase, utilizing keywords such as gestational diabetes, intervention characteristics, lifestyle interventions, meta-analysis, titers, and type 2 diabetes. Major findings revealed that diabetes prevention trials in women with a history of gestational diabetes were more effective when commencing within 1 year postpartum, underpinned by behavior change theory and in participants who were overweight or suffered from obesity.
So next is our case study patient lab results. So the participant's height at 28 weeks pregnant and 1 year postpartum stayed the same at 5'5". At the weight at 28 weeks pregnant, she was at 245 pounds. 1 year postpartum, she was at 200 pounds. Still a little above the uh range, the healthy range. Her BMI at 28 weeks pregnant was 40.8, and at 1 year postpartum, it was at 33.3. And that was still above the recommended range. Her A1C was at 3.9 at 28 weeks pregnant, and at 1 year postpartum was at 5, which is within normal range. Her glucose at 28 weeks pregnant was at 54, and at 1 year postpartum, it was at 69, which is still a little below the normal range. Her HDL cholesterol was at 39 at 28 weeks pregnant and 50 at 1 year postpartum, which is within the normal range. Um, and the LDL cholesterol at 28 weeks was 94, and at 1 year postpartum, it was at 110, which is now within the normal ranges. Now going on to our nursing implications. So for our nursing implications, we wanted to have patient education regarding diet, physical activity, and medication adherence, uh, educating for healthy lifestyles, and emphasizing the risk for type 2 diabetes once a woman is postpartum, as well as advocating for the integration of diabetes prevention in maternity care and primary care settings, implement the personalized care plans, behavioral support, and goal setting. Lastly, we would want to help the patient with setting realistic, achievable goals and ensuring that the patient has a support system. Now, going on to our conclusion. So for our conclusion, the lifestyle interventions such as weight, physical activity, and diet changes after a diagnosis of gestational diabetes has proven to be a life-changing option to reduce the progression of type 2 diabetes. It was found that participants with a prior history of gestational diabetes who implemented lifestyle changes had more than a 90% lower risk of developing type 2 diabetes. Many patients who were undergoing risk factor modifications during pregnancy with gestational diabetes saw reduced risk of complications and the incidence of type 2 diabetes. So not only did these modifications help reduce the incidence of type 2 diabetes, but they were also noted to improve the fetal health. While the implementation of intervention decreased the progression of type 2 diabetes, The interventions provided specifically during the postpartum period provided a higher likelihood of achieving the positive outcomes. Successful interventions during pregnancy varied, with most being effective if interventions were implemented early in the first trimester. Patients must ensure that they are following a healthy lifestyle consisting of periodic blood sugar monitoring, managing weight, and implementing a balanced diet, adhering to medication as prescribed, and attending follow-up appointments. So, evidence from these studies will impact the nursing practice by allowing the nurses to be able to make more informed decisions regarding the patient and their care plans, specifically with patients with gestational diabetes and aiding their prevention of developing type 2 diabetes. So, the evidence from these studies will also allow the nurses to provide more appropriate education to the patient and implement more effective evidence-based nursing interventions that will reduce the complications and consequential development of type 2 diabetes. And all these interventions combined can help improve not only the physical health of these women, but it can ultimately promote a healthier pregnancy and birth outcome.
If you guys have any questions, please leave them in the discussion board.
Thank you.
Thank you.
Thank you.